In this video, we're gonna break down difference between STD and STI. The first difference between STDs and STIs is in the name. STD stands for sexually transmitted disease, whereas STI means sexually transmitted infection. Essentially, the difference is between a disease and an infection. Not all diseases begin with infections, but many do. Sexually transmitted disease first begin as sexually transmitted infections. Infection occurs with the sexually transmitted bacteria or virus first enters the body and begins multiplying. But no matter which term people use, they're talking about the same thing: infections that get passed from one person to another during sex. These infections have had many different names over the years: venereal disease, the clap, the drip, and most recently, STD and STI. STI is the most up-to-date term. Educators and healthcare providers switched from STD to STI because infection is more accurate term than disease. Let's break it down. An infection happens when a virus, bacteria, or parasite enters your body and your immune system kicks in to try to fight it. Disease happens when the infection causes symptoms, damages parts of your body, and leads to illness. The good thing is, many infections never develop into diseases. How can I protect myself from STIs? Only abstaining from sex or not having sex offers complete protection from STIs. If you are sexually active, make sure to use a latex condom whenever you have any kind of sex. Condoms are especially important if you have multiple sex partners. Choose sex partners carefully. Don't have sex if you suspect your partner has an STI. Have sex with one person or monogamy. In order to protect yourself from STIs, you must limit the number of sexual partners. Each new partner raises your risk of catching an STI. Get checked for STIs regularly. Getting tested regularly for STI helps prevent spreading the infection to other people. You must ask any new sex partner to get tested before having sex for the first time. Avoid alcohol or drugs before having sex. Reports shows people who are drunk may engage in risky sexual behaviors, which can lead to an STD. Learn the signs and symptoms of STIs. If you notice symptoms, get treatment quickly. Some symptoms are an unusual discharge from the vagina, pain when peeing, a skin rash, unusual vaginal bleeding, itchy blisters, and sore around your genitals or anus. If you have an STD, you can take these steps to prevent spreading it to others. First, don't have sex until you see a healthcare provider and receive treatment. You can resume sex when your healthcare provider says to do so. Follow your healthcare provider's instructions for treatment. Return to your healthcare provider to get rechecked. Be sure your sex partner or partners also receive treatment. Always use condoms whenever you have sex, especially with new partners. Educate yourself about STIs. The timely and more you know, the better you can protect yourself and your partners. So keep in mind, get tested is only option to protect yourself from STDs or STIs. For more information about the STDs or STI testing, check the link in the description of this video.